Hello, class. So today we're going to be doing chapter 13, which has to do with dental caries. And in your Kindle, you'll see your objectives, how to pronounce, define, and spell the key terms, and I'll be going over that, classifying the dental caries as infectious and naming the two types of bacteria, and also explaining the caries process. With that said, too, I will be posting a small video with a demo model after the lecture. So, starting with dental caries, also known as tooth decay, is an infectious bacterial disease that has plagued human beings since the beginning of recorded history. Today, because of scientific advances and new technologies, dentistry is developing new strategies for managing dental caries. These strategies emphasize prevention and early intervention. Bacterial infection. There's two specific groups of bacteria found in the mouth that are responsible for dental caries. You have your mutants, streptococci, which is the MS, and lactobacilli. They are found in relatively large numbers in dental plaque. The presence of lactobacilli in the mouth indicates a high sugar intake. So, transmissions of caries causing bacteria. So MS are transmitted through saliva, most frequently the mothers to the infants. When a mother has a high count of MS in her mouth, the baby has a high count of the same bacteria in his or her mouth. Women should be certain that their own mouths are healthy. When the number of caries causing bacteria in the mouth increases, the risk of dental caries also increases. Oral biofilm is a colorless, soft, sticky coating that adheres to the teeth. Oral biofilm remains attached to the tooth despite movement of the tongue, water rinsing, water spray, and less than thorough brushing. Formation of oral biofilm on a tooth concentrates millions of microorganisms on that tooth. Oral biofilm, you may have heard of it as plaque, dental plaque biofilm, and microbial biofilm. Dental caries and gingival and periodontal infections are caused by microorganisms in dental plaque. So again, dental plaque or a biofilm. But most of the time in the office, we say plaque. And here is a picture of oral biofilm. Please look in your Kindle for a much closer up picture. I do want to mention that the disclosing tablets that we give will basically show the supragingival plaque covering 1/3 to 2/3 of the clinical crown. So as you can see in this picture here, it is showing that. That is the dark reddish portion of the disclosing tablet. Okay, this is under a microscope. And then C is the diagram is depicting the bacteria, the black plaque bacteria associated with tooth structure and periodontal tissues. Now, enamel structure. It is the most highly mineralized tissue in the body. It is stronger than bone. It consists of microscopic crystals of hydroxyapatite arranged in structural layers or rods, also known as prism. The water and protein components in the tooth are important because that is how the acids travel into the tooth. The minerals travel out and the tooth structure dissolves. So the caries process. For caries to develop, three factors must be present at the same time: a susceptible tooth, a diet rich in fermentable carbohydrates, a specific bacteria. Regardless of other factors, caries cannot occur without bacteria. So caries can also develop as a result of constant intake of acidic foods. This is called erosion. And what types of food or drink can be considered risky to the tooth because of their acid content? Well, it's your soft drinks or lemon cough drops, okay? And if a patient drinks only diet soda rather than regular soda, does this have a positive effect on tooth health? It does not. Acid breakdown of the tooth can occur with bacteria in the caries process or with acidic foods. Diet soda is more acidic than non-diet soda. So that was just informational, but it's good information. I was told once by a doctor that one of the sodas that a lot of people drink that he sees a lot of caries from is the clear ones, like your Mountain Dew, your 7 Up. Sipping on that all day long will just eat up the teeth, okay? So areas for development of caries. Pit and fissure caries occurs primarily on the occlusal surfaces and the buccal and lingual grooves of posterior teeth, as well as in the lingual pits of the maxillary incisors. Smooth surface caries occurs on intact enamel other than pits and fissures. Root surfaces caries occurs on any surface of the root. And secondary or recurrent caries occurs on the tooth surrounding a restoration. So the stages, it usually takes sometimes months to years for a carious lesion to develop. Caries is an ongoing process characterized by alternating periods of demineralization and remineralization. So demineralization is the dissolution of the calcium and phosphate from the hydroxyapatite crystals. Remineralization is the redeposition of calcium and phosphate in previously demineralized area. It is possible for the process of demineralization and remineralization to occur without any loss of tooth structure. So, couple of facts here. The minerals that are replaced during remineralization actually make the tooth stronger against acid attack than the original. And it is important to note that newly erupted teeth are especially vulnerable to acid attack because they have fewer minerals present at the surface. That is similar to the exposure of roots with their layers of less mineralized tissues. What can be done in the dental office to help promote remineralization of teeth that are newly erupted? Well, it all depends, like um, thoroughly brushing and washing your sugar intake, your diet, your soft diet. Give me 1 second, class. Class doesn't start until later. Yeah. I have to, for extras, 12:30. Yeah, I'm in the middle of lecture, so let me continue. Sorry about that, class. Demineralization and remineralization. So here is a picture of what is showing acids, the calcium and phosphate, the fluoride, phosphate, and calcium. And what you're gonna see is these white spots, and those are early lesions. So coming back to number one, the tooth is attacked by acids in plaque and saliva. 2, calcium and phosphate dissolve from the enamel in the process of demineralization. And 3, fluoride, phosphate, and calcium re-enter the enamel in a process called remineralization. So an incipient lesion develops when caries begin to demineralize the enamel. An overt or frank lesion is characterized by cavitation, the development of a cavity or hole in the tooth. Rampant caries describes the time between the onset of the incipient lesion and the development of the cavity. It is rapid and there are multiple lesions throughout the mouth. So here's what an early carious lesion. Coming back to that picture here, which will make more sense. This one here, that white spot. So early carious lesions, that's the white spot right there. Okay. And then here are some more carious lesions. Okay, they call them overt. They appear as dark stained areas between the anterior teeth and the areas in the pits and fissures. So as you can see here, here is between the mesial and the distal, and back here it would be on the pits and fissures, all these little brown spots on the pits and fissures. Here's on the occlusals, okay? And then here's your rampant caries. So there's multiple lesions that are always present with this type of caries. So in other words, if the M and the D, if the M is affected on one tooth, the D might be affected, the gum line is affected, And it really, this, when it gets here, it's pretty bad. And this one has a little bit of everything, because if you see the white spots around the gum line, then the brown spots, and then the rampant caries. So the stages there are all over the place. And then here you have severely decayed molar on a child. Now this can be an example of what's called baby bottle tooth decay, which happens to be a frequent exposure of a child's teeth for long periods to a liquid that contains sugar. So an example would be the baby falls asleep with a bottle with a formula, milk, juice, or they're sipping on it all day long. People who dip pacifiers in honey or anything like that. So primary teeth, they have thin layers of tooth tissue overlying the pulp, so they decay easily compared with thicker layered permanent teeth. Okay, and then the teeth most likely to be damaged are the maxillary anterior teeth, because they're usually the first to erupt and therefore expose the longest to the sugar in bottles. So this is pretty bad. This is probably not savable. By the way, this one here broke at the root, so you don't even see the coronal portion. This is decay on the lingual surface. So when it's at the gum line, it is class 5. Okay, so this is a gum line cavity, class 5. If it's in the pits or fissures, it is a class 1. Okay. And then secondary recurring caries form in the spaces between the teeth and margins of a restoration, not easily seen, thus diagnosis is difficult. New restorative materials may prevent recurrent decay. Root caries occurs on the root of teeth that have gingival recession that exposes root surfaces, becoming more prevalent and is a concern for members of the elderly population who often have gingival recession exposing the root surfaces. Older people often take medications known to reduce saliva flow, which contributes to caries. So anybody that says they might have dry mouth, that may be a cause of it. Carious lesions form more quickly on root surfaces than do coronal caries because the cementum on the root surface is softer than enamel and dentin. Like coronal caries, root caries have periods of the demineralization and the remineralization. Now here, recurrent decay. Recurrent decay is when you already have a filling. In this case, they're showing an amalgam filling. And in the interproximal area, the areas where you would floss, there's recurrent decay. So underneath that filling, so in order to get to that decay, that filling would have to be removed. Okay, so the arrows indicating a dark area. Now, root surface caries look like this. So of course they're on the root. So this is the crown or coronal portion of the tooth. And now this is the root. Unfortunately, the decay has not only basically messed up the gum line, but also has involved the root surface of the tooth, okay? These here, though they're slow to form and they don't cause much pain until most of the tooth, neck, or surface has been undermined. So the only thing you have to remember though, rampant decay can lead to excessive pain and suffering. This can cause sensitivity too to anything hot and cold that a person might drink. Moving on to early childhood caries, known as ECC, an infectious disease that can happen in any family. Many children live with the constant pain of decayed teeth and swollen gums. In some states, ECC affects 1/3 of preschool children. Tooth decay is the single most prevalent disease of childhood. Early childhood caries can be prevented with appropriate education of the parents and oral health care for the child. ECC is common among families of lower socioeconomic status. The rate of untreated dental disease among low-income children aged 2 to 5 years is almost 5 times higher than that seen in higher income families. ECC is more common among particular ethnic groups in those families who have limited access to dental care in areas where water fluoridation is lacking. It's also more common among children with special needs. Now, how do children get ECC? It is a transmissible disease. Bacteria in the parents' or caregiver's mouth are passed to the child. It is important for parents to keep their own teeth healthy to keep their child's teeth healthy. Baby bottle decay is another term for ECC. The importance of saliva. Physical protection involves a cleansing effect. Thick or viscous saliva is less effective than a more watery saliva in clearing carbohydrates. Chemical protection contains calcium, phosphate, and fluoride. It keeps calcium at the ready to be used during remineralization, and chemical protection includes buffers, bicarbonate, phosphate, and small proteins that neutralize the acids after we ingest fermentable carbohydrates. So currently there are fluoride varnishes that are safer and easier to use than gels or foams because their less systemic intake is required by the patient for remineralization. Antibacterial substances in saliva work against the bacteria. If salivary function is reduced for any reason, the teeth are at increased risk for decay. Caries diagnosis. So the following methods are used to detect dental caries, and each has specific limitations. Dental Explorer, radiographs, visual appearance, indicator dyes, or laser caries detector. So, caries detection devices. Several types of devices have been developed that can provide a higher level of discrimination in the diagnosis of dental caries. Some detect bacterial byproducts and quantity sound signals to aid in caries detection. Some detect differences in tooth structure and display information on a screen. And others have software that analyzes density changes on digital radiographs and outlines potential lesions. With the laser caries detector is used to diagnose caries and reveal bacterial activity under the enamel surface. Carious tooth structure is less dense and gives off a higher reading than non-carious tooth structure. And the Diagnodent, this is one of the machines here. It directs a laser beam into the occlusal surface. Of course, one shouldn't rely totally on the readings. The laser caries detector is not a standalone diagnostic tool. Some of them might even look like this, the pen, okay? Most doctors use the visual and radiographic appearance of molar. Even you sometimes can tell. I showed you a tooth that was decayed. You don't need an x-ray to tell you that. I mean, you could see it. What the x-ray helps is to see how deep it is. Here's a cross section of a molar, okay, what it looks like. And there, anything brown is decay. Then there's the camera. Caries management by risk assessment, an evidence-based strategy for preventative and reparative care for early dental caries that can be used in any dental office. A dental health professional assesses an individual's risk factors and protective factors, then determines the level of risk for caries, and an individualized preventative plan is developed based on the determined level of risk. Not all patients are equally prone to caries. There's methods of caries intervention. You have your fluoride. A variety of types are available to strengthen the tooth against solubility to acid. Antibacterial rinses, products such as chlorhexidine rinses are effective. Decrease fermentable carbohydrates, reduce the amount and frequency of ingestion. Increase salivary flow, chewing sugarless gum, for example, one with a non-sugar sweetener such as xylitol. Xylitol now, before xylitol, you barely saw xylitol, except in gums and maybe in some mouth rinses, but now you will see xylitol on the shelves. You just have to look on the labels and see what it's made out of. And maybe we didn't notice it much before, but now you hear about it even more. So again, these are some of the examples that I mentioned. Caries risk assessment tests are used to identify the factors that contribute to an increased risk for dental caries. If the patient's risk for dental caries can be determined, it is possible to prevent the caries from developing by beginning appropriate preventative treatment. Risk assessment tests for caries are based on the amount of MS and lactobacilli present in the saliva. High bacterial counts indicate a high caries risk, and low counts indicate a low risk for caries. And patients in whom a caries risk test is indicated is new patients with signs of caries activity, pregnant patients, patients experience a sudden increase in the incidence of caries, individuals taking medications that may affect the flow of saliva, and serostomach patient. Patients in whom a caries risk test is indicated, patients about to undergo chemotherapy, patients who frequently consume fermentable carbohydrates, patients suffering from diseases of the autoimmune system. And at this time, I am going to ask if there are any questions. Anybody has any questions?